My name is Jeff Winton, and I am the founder and the chairman of Rural Minds.
Can you tell me about your own mental health journey?
Well, I come from a family that has quite a prevalence of mental health issues. However, which is typical of many families, especially farm families like my own, families don't talk about things they should talk about. And it wasn't until my 28-year-old nephew died by suicide several years ago that my family finally started acknowledging and dealing with what we had been faced with for generations. And so, myself, I had never really given it much thought, but it was really a few months ago I realized as I travel around the country on behalf of Rural Minds and do the work that I do, that I was giving good advice to people, but I wasn't following my own advice. And I realized that not only because of the genetic predisposition of these illnesses, just like many other illnesses, but due to many other challenges that those of us in rural America faced, that I was at a point where I needed to go into therapy and get some treatment. So this personally is all new to me, but my family's journey has been going on for generations, I dare guess. And then we founded Rural Minds 3 years ago, again, in memory of my nephew who died.
Yeah, what is it like taking that journey and making it an organization to create Role Minds?
Well, it's been a very interesting journey the last 3 years as we planted the seed and launched Rural Minds. My nephew died in 2012, but when he died, he left behind 3-year-old twins. And so my family made the decision to wait until his children were older before we launched Rural Minds so that we could talk openly about it and actually have a very candid and transparent conversation with them as to why their daddy isn't here anymore. So we had the opportunity to start doing a lot of the legwork and planning, and then we launched a little over 3 years ago. And the main reason, Mike, that we launched is because when my nephew died, I started reaching out to a lot of the other mental health advocacy organizations, organizations that I have a great deal of respect and admiration for. And I had worked with them as part of my career because I've worked in healthcare for a good share of my career. So when I started calling the people I knew at the big organizations and told them the story and said, "This is now personal. What are you doing for the 46 million people who live in rural America?" A number of my calls were met with silence, respectful but silent. And then with the admission that they weren't really doing much at this point for people that lived in small town America because their efforts had been predominantly focused over the years on urban and suburban audiences. But the fact remains 46 million people, or 14% of our population in America, live in small towns like where I'm talking to you from. And it was a real wake up call for me that there was no concerted effort to reach people that were living in areas like where I live and where my family has lived for generations. And so that was the genesis of Rural Minds.
Yeah, I know for me, I live in the suburbs of Washington, D.C., so I hear a lot about suburban areas, maybe on the East Coast, but I grew up in Illinois, and I know there's tons of people there that aren't
Yeah.
getting the same help.
Yep. Well, I was most recently living in Illinois until I moved back to our farm here in New York. Due to my career, I was living out there in suburban Chicago. And when we launched Rural Minds, I said, if I'm going to be an effective advocate for people living in rural America, I can't be living in a comfortable suburb of Chicago. I have to become
Right.
one of the people I advocate for, and I need to move back to the farm. So 3 years ago, I moved back to the area where I grew up. I'm sitting here looking out the window. We're in the middle of another blizzard. We're on Lake Erie, very close to Buffalo, and we've already had 150 inches of snow, and it's
Okay.
only mid-February. So, but that's one of the reasons that people struggle in rural areas, especially in areas like where I live. The winters can be very long, and seasonal affective disorder is a real thing, and people really do struggle with that. So, I must say, even though I'm from here, I grew up here and I've owned a farm here for almost 20 years, I hadn't lived here. And after having lived in big cities like New York City and outside of Chicago and worked outside of Los Angeles, moving back to a town of 500 people and living on a working dairy farm where you get up at 5 every morning was a real challenge. But it was the absolute best thing I could have done because I now much more fully understand why people in rural America struggle, why people in rural America are 65% more likely to die by suicide due to mental illness than people in suburban and urban areas. Farmers and ranchers are twice as likely to die by suicide as other occupations. And I instinctually knew that before I moved back here. But now that I'm completely immersed back in this area and another farm I have in Kansas, outside of Kansas City, I see firsthand the challenges and obstacles that people face each and every day living in rural America.
What are some of your programs?
We have a number of programs that have been launched in the last 3 years. And first of all, I would encourage people to go to our website, which is ruralminds.org. And many of our programs are showcased on our website. We've spent the last 3 years really developing partnerships with a lot of other long-standing and existing, not only mental health organizations, but organizations that represent rural people in general. Organizations such as the Grange. The National Grange is the oldest and largest agricultural nonprofit organization in the country. They've been around 157, 158 years. And so they're very well established and they are found in 1,500 communities across the United States. We chose them as our initial partner because we knew it was a race against time, because every 11 minutes in this country, someone dies by suicide. So we didn't feel that we should take the time to start building new venues for people to go to. We wanted to partner with an organization that already existed. And the Grange has done a lot of work in healthcare over the years, but they do a lot of other work in agriculture and other topics important to rural Americans. But they hadn't really ever done a deep dive into rural mental health. So when we came together, it was a wonderful partnership, and it's still among our most important partnerships because we are helping them fill a need with the people that they represent in those 1,500 locations. And in turn, we now have access to all the people that are part of their organization. So it's really been terrific. We
Wow.
launched about a year ago a program with the Grange called the National Rural Mental Health Resilience Program, which again is on our website. And people that grow up in rural America, especially on farms like I did, are taught from the time you're a young boy to be very resilient, to pull yourself up by your bootstraps, to not talk about your problems, to not ask for help, and certainly don't talk about anything uncomfortable. The fact remains mental health and mental illness challenges is still something that makes many people uncomfortable. And hence the stigma that we have. that we are focused on fighting through our work at Rural Minds. Mental illness in rural areas is still much more highly stigmatized than it is in rural and suburban areas. So the program we launched is really a do it yourself grassroots program so that people in rural areas, whether it's a church group, a Grange group, 4 H, FFA, the Farm Bureau, the Volunteer Fire Department, the PTA, whatever the group is, if they have a heart and an interest in doing a program on mental health, we've made it very easy for them. All the materials are on the website. They're all free. They're all downloadable. We have everything from PowerPoint presentations, if they want that, to press releases on how to promote their event and everything else in between. Lots of fact sheets, lots of other materials. So that's been a very important program for us. We've also had a wonderful partnership with Pfizer, the big healthcare company. We did a radio media tour in December before the holidays talking about holiday blues and what people go through during the holidays because people living with depression or anxiety or PTSD or whatever the condition may be can really struggle during the holidays because we're taught to be happy and joyous during the holidays. And if you're living with major depression, that's a hard thing to do. So that was the first phase of our program. And we're now just getting ready to kick off a second phase talking about loneliness in the United States. There was a recent survey, and you've probably seen it, that said 1 out of every 2 people in America said they're lonely. That's 50% of our population. We've got a huge, huge issue. So we will be embarking on another media tour. It's primarily radio on that topic. Another new program we're rolling out in conjunction with a number of partners, including Boehringer Ingelheim, the German healthcare company, is a program geared towards rural youth and people that grow up in rural America, like I did. Young people are 54% more likely to consider suicide than their suburban and urban counterparts. And within the last year, 1 out of every 5 high school students has seriously contemplated suicide. So, this new program that we have launched just recently in November is aimed at young people who live in rural America. And so, we're partnering with the FFA. A lot of people know them as the Future Farmers of America, with the 4 H organization, with the Grange, and with some other rural groups to help make young people in rural America our ambassadors so that peer to peer counseling and support is taking place in rural areas. In rural areas, and again, you grew up in Illinois, so you know, healthcare access is a huge issue. We don't have nearly the providers we need, including primary care providers. When I moved from suburban Chicago back to the farm here in rural New York, I waited 8 months to get into a primary care physician. And
Eight
fortunately, I
months.
wasn't ill. If I was, I would have had to go to the local emergency room. But there's such a shortage of even primary care physicians in rural America that we have a real problem. And then you look at the prevalence or lack thereof of providers such as psychiatrists. And the last statistic I saw is that 65% of counties that are considered rural in the United States have no psychiatrists. 65%. So we are hoping that people will start to rely a little more on telehealth, which has become, of course, more prevalent since COVID hit. However, one of the issues we have with telehealth is the fact that 30% of families in rural America have no broadband service because it's not available. It's not that they can't afford it, it's just not available. And you'll appreciate this if you lived in Illinois. I was doing a program in Southern Illinois not terribly long ago. Not only did they have a challenge with broadband, many of the people down there didn't even have cell service. There weren't adequate cell towers. So people in this day and age were living in this rural area without the access to cell phones, which, the rest of us take for granted. So we have a lot of issues that we're tackling right now. Insurance is another one. Many people in rural America are self-employed, especially farmers, and either they can't afford insurance at all, or they have insurance that is inadequate. I did a program recently in Washington, and one of the leaders, who was a farmer from Indiana, approached me and told me his story after I spoke, which often happens because people aren't always comfortable raising their hand during a meeting. But I normally have people that seek me out after the meeting's over, which I welcome. And I take as a real humbling honor to be able to hear these stories. But this gentleman said that, again, he was a fairly well known farmer, that he had to make decisions about his health care because he had inadequate insurance and he was living with both depression and diabetes. And he said, I know if I don't take my diabetes medicine, it will kill me. He said there's a good likelihood my depression is going to kill me as well if I don't get help. But he said, I had to make a decision. I had to choose between treating my depression or treating my diabetes. And that was just heartbreaking to me. In a country like the United States, no one should have to make that decision, a life or death decision between one disease over another.
For you, what is it like talking to people that are being impacted and being helped by your organization?
Well, as I mentioned before, at times it can be heartbreaking because I hear these stories that haven't really been told. And that's why I'm focused on doing as much media work as I can because the 46 million people in rural America are hidden. They're not on the front page of the New York Times. They're not on CNN. They're not the big stories, but yet it's a very important part of our population, especially since these are the people growing our food and fiber. If it wasn't for the farmers in rural America, we'd have no food, we'd have no clothing, we would be in big trouble. So I am looking at this as a chance to educate both people in rural America that there is hope, that there is help, and this is where you need to look for it, as well as people that live in more suburban and urban areas, that we've got a growing crisis in rural America and we need your help. We need your advocacy. I must say that I've been very encouraged the last 3 years since we launched Rural Minds because I'm hearing a lot of stories that people have never told before. And inevitably, I always start out when I give a talk with my family story. And I go into more detail than I went in with you today about what we think led to my nephew's death and other elements. And it's important to be candid and to put yourself out there and to make yourself vulnerable for the sake of humanizing what people are going through and putting a face on this growing epidemic. And it is an epidemic that will be around much longer than COVID will be. We've made major strides in controlling COVID. We still have a heck of a lot of work to do in addressing the mental health lack of equity in rural America. But I'm I'm very encouraged and grateful and thankful that people now feel that it's okay to talk about what's been hidden for years, if not generations. I told you the story at the beginning of our talk about my own family who never talked about this until my nephew died. And now we talk about it much more openly and readily and without a shame, feelings, or embarrassment. And I'm starting to see this around the country again as I travel, that people just need to be told it's okay. It's nothing to be embarrassed about. It's an illness, just like cancer's an illness. If a person is living with prostate cancer or breast cancer, you don't try to hide it. You, A, go and get help for it, of course, but B, you tell your friends and family what you're going through. People living with heart disease do the same thing. People living with diabetes do the same thing. But for some reason, people living with schizophrenia or bipolar disorder or alcohol use disorder still feel marginalized and they don't feel like they have the opportunity to talk about it with other people. So we spend a lot of time with storytelling and to ensure that people know all you need is one person to confide in. And they may not even be a provider, they might be your next door neighbor. They might be somebody from your church. They might be somebody you know from the local barber shop or diner. And they may not be a trained mental health provider, but it doesn't matter. What matters
Right.
is that you have somebody that has your back and somebody you can talk to that can then help you look for the help that you probably need at that point.
What do you do to help your own mental health?
Well, I am doing a number of things to help my own mental health. I try to stay pretty physically active. Of course, living on a farm, by definition, you stay pretty active. I used to be a runner, but my knees are starting to give out. So now I'm doing race walking. Everything I do is pretty fast. So I figured, well, I'll start walking. And then before I knew it, I was doing race walks. And before I knew it, I was entering races. And I'm pretty fast. I'm a pretty fast walker. Um, but I also have tried to spend some time at the beginning of the day and at the end of the day, really focusing on what I have to be grateful for. And I have a lot to be grateful for. We all have a lot to be grateful for, but we get caught up in our issues. We get caught up in the problems of the world. We get caught up in what we're reading in social media and what we're seeing on CNN and Fox News, that becomes overwhelming. And we don't take a step back, take a deep breath, and remind ourselves we have a lot to be grateful for. This is something I just really learned in December. I told you about this program we have with Pfizer. And the medical director from Pfizer, a wonderful woman who's my partner in the work we're doing, said this is how she started her day. And I thought, you know what? She does this for a living. If this is what she does, I'm going to try it. And certainly within 10 minutes every morning of sitting down with a cup of coffee with my dog by my side, I practice this and it's made a huge difference. The other thing is, of course, living on a farm, you would imagine I love animals. I try to spend as much time with my animals as possible. I have a number of horses. I love riding horses. Horses are very, very therapeutic. That's why they use them in so many therapeutic programs with veterans and with people who have been abused. And so, whenever I'm around one of my horses, even if I'm not on the back of the horse, I just throw my arms around the neck of the horse and that helps my mental health. I'm about to go into therapy. It's not easy, as you would imagine, finding a therapist in rural America. And
Right.
while you can find therapists online, and ultimately, I think I'll end up with a hybrid situation, someone in person as well as a hybrid. I'm a very relational kind of person, and I really want to find a therapist somewhere within an hour radius, hopefully, of where I live, where I can go and look the person in the eye, face to face, and make sure I have the chemistry. Because having chemistry with a therapist is critically important. And we always tell people that if you go to your first therapist and you don't feel like you've connected with them, then you need to go to the second, maybe the third. You will find someone, but you're going to be talking about pretty heavy stuff. And you need to make sure that you feel comfortable with that person. So I'm in the exploration phase right now. I've talked to a couple. I still haven't found the right person yet, but I'm getting closer. And so I'm excited about it. I've never gone to a therapist. I've never felt like I needed to, but I now realize we all could benefit from
Yeah.
therapy. But again, because of the stigma that surrounds going to a therapist, especially in rural America, many of us haven't allowed ourselves to partake in therapy sessions that, in many cases, are life altering. And I am extremely excited and enthusiastic about the future uh, once I find the right person.
Yeah, it took me a long time to go to therapy, but I've been the past few years and it's game changing. It has, give me a new outlet to share stuff.
Absolutely. And especially important is the fact that it's somebody who's somewhat removed from your daily life, right? I mean,
Yes.
we all have friends and hopefully family members we can talk about certain things with, but sometimes you just need somebody who's not in your inner circle, who doesn't know you that well, who will give you an objective opinion and ask you questions that your friends and family may not ask. And so, thank you for sharing that. I'm hoping to discover the same power of therapy here in the very near future.
What would you say to anyone going through a tough time?
I would tell people going through a tough time that there is hope and that there is help. And I realized that at times, like in the case of my nephew, who clearly didn't feel there was a way out, that if he had felt comfortable talking to anyone in our family or anybody in the community, we would have helped him and we would have tried to find him a therapist or find him the right medication or whatever he might have needed. But so many people just feel that they're alone and they don't feel like they should burden anyone with what they're going through. And the fact remains, we're all human beings, regardless of what we do, regardless of what our bank accounts look like, regardless of where we live or who we love. We all have issues. We all have problems. Some of us are more honest with ourselves than others. But once you get to a point where you realize something isn't quite right, you need to feel comfortable that you can voice that without the fear of being ostracized or being judged.
Yeah.
And there's plenty of help out there in rural areas. Again, you may have to work a little harder at finding it, and you may have to drive a little further, and you may have to pay for some of it out of pocket because of the insurance issues. But we are hoping through our work and our partnerships with many other for profit and nonprofit organizations that we can shine a light on the help that is available. And I would be remiss if I didn't mention the 988 number. The 988 helpline was rolled out 3 years ago. Rural Minds, we were very early in our launch at that point, but we represented people in rural America on the work that was done before 988 was rolled out to make sure that they were going to be able to not only speak the language that people in rural America expect to use, but also to have the services available. So it's a service that has saved, I would dare to guess, thousands and probably tens of thousands of lives over the last 3 years. It's a free service. It's a 24-hour a day, 7 day a week service. It's anonymous. So if you don't want to provide your name, if you are worried that it's going to get out that you've called for help, you don't have to worry about any of that because it's completely anonymous. The beauty of the 988 number is it not only will help you through your darkest hour, the times that you need someone, even if it's 2:30 in the morning, but they will also help you find local assistance in your area. Because the way the 988 number works is that it's a fairly sophisticated system, but when you call, the system recognizes the area code you're calling from. So you're triaged to that part of the country where you live, or at least where your cell phone was from. Sometimes if you've moved around, that's not always the case. But um, so, but once you have, spent how much ever time on the phone, or you can do this by text, by the way, you can either text or call 988. The person you talk to, and I've talked to a couple of them myself, will then the next day or even that evening or whenever you call them, will say, okay, I just found a service and it's 20 miles from you. Would you like me to help you get an appointment? It's a tremendous service. And again, 988, I can't remember long numbers like we used to have with a lot of the helplines, but 988 is a very easy to remember number. Just in case I can't remember it as I get older, I have it in my contacts in my cell phone, but most people can remember the 988 number. And it's not just for the person who is facing a tough situation, it's for their loved ones, it's for their family members, it's for anyone who cares about them. If you see someone in trouble and you don't know what to do, you can call and say, this is the situation. My friend John really seems to be struggling. I'm worried he may harm himself. What should I do? What can I do? And of course, the other thing is we have the 911 number. If for whatever reason you don't want to call 988 or you can't, by all means call the 911 number and you'll be connected, of course, to the local authorities who, are now pretty well trained in how to help people that are going through a difficult time. Again, our website, ruralminds.org, has a lot of information on it. And there are just a lot of resources out there. So no one should feel that they're alone, or no one should feel that there isn't help. There's plenty of help. But the bottom line is you have to admit you have a problem, and you have to admit that you need help, and you have to reach out to somebody, whether it's directly to that service provider or the counselor, or through someone, your friend or your family member, who can help you make those connections.
You've already done so much in 3 years, but where do you want to see your mission in the next 3 to 5 years?
Well, we have a lot of work to do, a lot of work to do. Again, I've shared with you some of the sobering statistics about what we're facing
Yeah.
here in farming communities, mining communities, fishing communities, the indigenous people, the Amish. Rural America is a pretty diverse group of people. And that's one thing that when I talk to non rural people, they find it hard to believe. They just assume it's a bunch of middle aged white people walking around. But the fact remains, depending on where you are, it can be a very diverse population, a very rich tapestry of people. So we're very focused on expanding now outside of some of the work we've done. We will continue to focus on agricultural communities and farming communities and things of that nature. But we realize there's a lot of other underserved populations, including veterans, by the way, that many veterans live in rural areas because, especially if they're living with post traumatic stress disorder due to combat, they want to be in a quiet area. They don't want to be in a city where they're hearing cars backfire and horns and guns and all the things that come with city life. They want to be in a quiet area. So we're hoping to do more with rural communities. I've already mentioned youth. We're going to continue to expand our work in the storytelling arena. We're looking at doing even more in the digital health and the telehealth area. We're looking at getting more involved in policy matters because right now is a very small but quickly growing organization that, every penny matters. We had to be very
Yeah.
focused and very deliberate as a nonprofit on what we focused on, but we know we need to have our voice heard in local government, state government, and at the federal level. So we're hoping to eventually get more involved in policy matters. And another thing that's even further down the road that we're looking at is doing work outside of the United States. I had the privilege of being invited to a meeting 2 years ago in Denmark and just this past summer in Lisbon, in Portugal. And both meetings were by invitation only, small groups of people from around the world who work in mental health advocacy. And I was the only person at both of those meetings that represented rural people. And I had people from England, people from the Netherlands, people from Sweden, people from Korea, even people from the Middle East approached me saying, we've never even thought about people in the rural areas of our country. Because the fact remains, most countries have rural areas. But just like
Yeah.
what was happening in the United States, people were so focused on people in big cities and suburban areas that they forgot about the people that lived in the countryside who were providing their food and fiber. So I've had some pretty interesting conversations with people in other countries. We're doing actually quite a bit of work in Canada right now in conjunction with some of the Canadian organizations. And I live less than an hour from the Canadian border. So growing up, I kind of considered myself a dual citizen of both Canada and the United States. So, and except for the French speaking part of Canada, Canada's pretty easy because we speak pretty much the same language.
Yeah.
So we're excited about at least igniting some interest and some passion in other countries so that they too are doing what we're trying to do here in the United States. So the work is endless. At the end of the day, I'm exhausted, but I feel so good about what we're doing because I know we're making a difference. And I know that we're finally giving a voice to people like my family and people I grew up with that never really felt like they had anybody that cared or who advocated for them before. So I'm humbled and I'm grateful for the work we've been able to do at Rural Minds.
How can people reach out and learn more?
I would suggest people reach out to us through our website, again, ruralminds.org, and also follow us on social media. We're very active in social media and are pretty much on every platform. I know every day it seems like another platform comes out, and I can't even keep
Yeah.
track of where we are, but we're on most of the major social media platforms. We have a very informative new newsletter. That's our next issue is coming out next week. So people hurry and go to our website and sign up for our newsletter. That will keep them informed of things we're doing. But ruralminds.org is the best way that they can reach out to us. There's also a phone number on the website that people can call. And I believe there's an email address as well. So many ways that they can reach us.